Are you a couple or a woman planning a baby? Then this is the story you'll especially want to watch. The number of babies born through C-sections are on the rise in private hospitals in urban India. In fact, it's much higher than is medically required. What's behind this worrying trend? Are C-sections being conducted for non-medical reasons? Are women now just too posh to push? Or is it the increased medicalization of the birthing process? Snigdha Basu reports.
World Health Organization recommends a rate between 10 to 15% for cesarean deliveries. Up until 2010 for India, that rate was at 8.5%, which has now grown up to 17.2%. We try and find out what are the factors behind that rise. 28-year-old Anupama, a travel consultant, was at work until her water broke and she was rushed to the clinic. But despite what her peers suggested, she has opted for a natural birth. You're opting for the hard way out?
Yeah. I want to prove that I'm a strong woman.
And when do you hope to get back to work?
After 6 months.
Gynecologist Dr. Gaur says very few patients like Anupama are willing to go for a normal delivery. 30% of her patients from the very beginning of their pregnancy say that they don't want to go through the pain of labor. According to the National Family Health Survey 4, the number of C-sections in Delhi are at 23.7%, Andhra Pradesh at 40% and Kerala at 35%.
In urban areas, what happens is that there is a lot of medicalization of the treatment. So the entire pregnancy care and the birthing plan is discussed with the doctor. Medicalization of pregnancy, which is actually a physiological process. It is not a disease or a pathological process.
With overwhelming population in both urban and rural parts and the doctor-patient ratio being skewed, it is impossible for a doctor to devote so much time to a single patient. Another important cause is the doctor-induced demand for C-sections.
Normal delivery is hard work. It may be hard work for the patient, it's much more hard work for the doctor. While cesarean is a gift check for us, cesarean has been sold as a safer option when actually, of course, it is exactly the other way around. Long-term backache, loss of sex drive, lower abdominal pain.
The problem of unnecessary C-sections is also part cultural, with the Muhurat baby fad where astrologers advise families about the right time.
मैंने इसलिए फ़ोन किया था पंडित को ये पूछने के लिए कि इस टाइम कुछ ऐसे ग्रह तो नहीं चल रहे, कोई मूल के ग्रह हो या कोई पंचक हो. सिजेरियन करते हैं तो एक पंडित से टाइम लेके करते हैं कि पर्टिकुलर उस टाइम पे कर रहे हैं हम, तो उस टाइम पे कोई ग्रह नहीं है, कोई कुछ नहीं है.
We reached out to private hospitals and the MCD to provide us details about the nature of births, but none responded. The two we accessed on terms of anonymity have a C-section rate ranging from 56% to 75%. So what is the solution?
The country as a whole has to have a policy. They have to train midwives. There should be midwife-led units. There has to be less medicalization of pregnancy.
Like the advantages of normal, was it given to you by the gynae or was it your own research?
It was my own research. There should be like a detailed counseling sessions about pro and cons of each and everything. Either you should opt for normal or cesarean.
Cesareans are increasingly becoming ingrained into the psychology of society. There is an urgent need to educate pregnant women about the implications of C-sections so that they can make an informed choice. In New Delhi, Snigdha Basu, NDTV.